let's not forget the home visits. We have special home visits that comes with specific needs assessment. Like when you meet a CVA client, you should find about who takes care of him or her, because the patient cannot take care of himself alone. You should do head to toe examination. You must check BP and counsel clients accordingly. Emphasize on hygiene needs. If you meet a pregnant woman, you're going to interview the clients about diet, bowel movement, rest and sleep, exercise, birth preparedness, healthy timing, danger signs, prevention of malaria. You check vital signs, perform general examination, inspect and palpate the abdomen, wash and dry hands, then encourage early reporting when labor sets in. So that one you have to also check the um, ANC book and cancel accordingly. Yes. When you meet a new baby, you have to do head to toe examination of the newborn, do vital signs, but you won't add blood pressure. Then you ask about the feeding pattern of the baby, weigh the baby, check the baby's weight according to the CWC card. And you also have a scale that you can use it to weigh the baby. You don't have the baby scale, so you let the mother, you weigh the mother, then you weigh the mother whilst holding, the mother is holding the baby, then you subtract the mother's weight from them combined. Then you get the baby's weight. Yes, then based on that, you use it to cancel, set your objectives and cancel the client. When you visit a malnourished child, you have to do assessments and cancel as such. Head to toe examination, you weigh, you do your measurements of malnourished children using the MUAC assessments. And then when you meet a diabetic client, you have to inquire and cancel on the general well-being, occupation and lifestyle, diet, what they know about the condition, medication and exercise, out, and then you teach them to alleviate anxiety. When you meet a hypertensive client, you have to inquire about general well-being. You have to check the feet and the sacral areas. You search for edema in those places. Then you cancel, and also based on the medication, you also cancel them on how to take it. When you meet a TB client, you inquire about general health, diet, bowel movement, sleep pattern, drugs, availability of support, dates for review, relationship with family and community, to make sure that they are not isolated. Any special so after needs assessment, you have to confirm what the problems you identified. Sometimes the client said something and you understood it in a different way. That is why you need to confirm with the client. And in that case, we call it setting objectives with the client. What you can see that in our conversation, you said that you don't sleep early. You sleep around 10 p.m. But most of the time before going to bed, you can eat even and PC at 9 p.m. Is that right? Clients will say yes. Say okay, we'll talk about that. You also mentioned that you usually wake up with headache and you urinate a lot at night. Yes, we'll talk about that. After that, I'll also check your vital signs and I'll give you education on the medication that was given to you at the hospital so that you'll be able to take it in the appropriate way. So you set objectives with the client, involve the client for the client to know what you are about to do. Yes, what you are going to talk about, the pattern of your counseling. After the needs assessment and setting your objectives, you now put your notebook down, back in the bag or down. Most examiners want to see the objectives you have set, what you are going to talk about. Other examiners want you to continue with the process. So if you show it to the examiner can point to you which ones to do or which tasks to tackle, or they can tell you to choose your own task. So checking on vital signs is a task. Education on medication is a task. Counseling on nutrition, all those things are tasks that can be the work. So